So I think of foundation training as a type of chiropractic technique. So let me expound on that. Now this is Samantha, and this is from a case study I did in the summer of 2025. And I meant to do a lot more work on this, but a lot of stuff came up in my life. And I want to do more of these too. I worked with her for 6 weeks, and it was an interesting case. There's a reason I chose her, because it was more than just back pain. And when we talk about chiropractic, we get into the realm of the nervous system being affected, and therefore every organ system being affected. And the word thrown around will be this subluxation idea. So how could something like foundation training, something that's physical movement and exercise, if you will, affect misalignments in the spine that are causing nervous system interference, which is part of the definition of a subluxation, right? It's not just a misalignment. It's not just a curvature. It's a bone out of place that's causing nervous system interference. So what does that mean? We're getting aberrant signals, so it's causing some sort of pressure, and that might not be just direct pressure. It could just be that the joint, the facet joint, is swollen and there's irritation on the nerve root or local nerves or the cord itself, strain on the cord itself. That's either affecting other organs, or there's something that's causing that misalignment, right? And there's different schools of thought here. So let's even talk about her neck here, if you can see my mouse cursor. So we can see this right upper trap. It's very tight, and her hair's in the way, and this is described in the text, is that the right side is compressed. It's pushed down. So we have this right suboccipital space under compression. And what will happen is this atlas bone will be shoved to the left. Now this could be a compensation. Not all misalignments in the spine are considered subluxations, right? They could be a compensation. This could be a compensation to another misalignment, which they call the primary misalignment, which is the subluxation somewhere else in the spine. Now, a lot of chiropractors will talk about it can only be the atlas, but there's other schools of thought, and there's other techniques, right? There's chiropractic techniques where you're not even touched, right? Like network, where it's more energy work, right? So don't think outside the realm of the possibilities that foundation training can operate as a technique for addressing these misalignments. So compression, this compressive force due to this right tight SCM, right tight upper trap, compressing, pulling on the occiput, compressing, causing a misalignment. Chicken rag, where'd it come from? Was it the muscle? Is it the nerve sending aberrant signals? So do we have an inhibition here of the other side that's causing this to be hypertonic and tight? Is that what's happening? And then you have to ask a further question of why? Why would the body purposefully decide to have a misalignment like that, right? Not being forced to, but purposely choose, right? And I call the spine the great compensator, because yes, this could be coming from somewhere like here, or even in the feet. It could be a hip issue. It could be a lower spine issue. And that this is doing this on purpose to help with functional movement, right? It's being forced to. Neurologically, the spine is responding to some other sort of restriction or weakness in the body. So there's one way to think about it. And before we get too in the weeds, because I'm just trying to give you some examples of how we strange chiropractors think. Before we get too in the weeds, in foundation training especially, we think of compression as the main thing we're working against. When Dr. Goodman came up with this stuff, he had a terrible, I believe it was L5S1 disc. He was told he had to have surgery. He was in chiropractic school at the time, right? So he had this philosophical understanding of, okay, how can I help my spine? Obviously, he's trying chiropractic. If he's in school, he's probably everybody, student and teacher, are all trying to adjust him. And I'm in a similar boat myself. I went to everyone. I tried every technique to try to help me. So I understand where he's coming from. When you're in school, you're doing a lot of sampling. I was the first person to raise my hand. And would anyone like to be the guinea pig for this adjustment? Me. Crack it, pop it. I don't care how you do it. Maybe this is the technique. This is the one I've been missing. This is the magical adjustment I've been waiting for. I like to tell people that magical adjustment probably does not exist. Not that it won't help, but we need something outside of chiropractic. And what I'm suggesting here is the subluxation, it plays second fiddle to these issues of movement and breathing. How we move, how we breathe, create patterns that the spine, neurologically responds to, purposefully creates these misalignments or subluxations, if you will, to help us to continue to move. And one of the biggest things that we'll do is compress itself as a protective mechanism. You think about anytime you're afraid or you watch an animal get afraid. I always use the example of a dog. You see it tuck its tail, it'll shrink. It's in self-defense mode. It's just how we respond to pain. Sometimes you got a bad sprain in your neck. You try to get tall. Oh, it's going to hurt. Right? You're gapping damaged tissue. You're lengthening it out. It doesn't like it. That's the mechanism of a sprain, right? So when we work on decompression, it's very careful how we do it, because it's not just lengthening someone out. Sometimes that feels really good, but sometimes it can hurt, right? So one of the tests I'll do to you, right? You get in the table, I push down on your head, I lift up on your head, I lift this way, I lift that way. What am I testing for? I'm testing for, is there some sort of muscular or joint sprain already present in the body? Enough. It's probably there, but sometimes it's not enough to really, ooh, ow, oh yeah, that was sharp right there. Let me know, okay, there's some damage there. But if there's pain, there's damage. We already know that. And I was thinking about it today. It's like an alarm clock. We hate the alarm clock when it's blaring in your ear at 5 a.m. Time for foundation training class. That's what you should be doing at 5 a.m., by the way. Getting up to go to foundation training. If you don't get up, right, if the alarm doesn't do its job, doesn't blare in your ear annoyingly, you're going to suffer the rest of the day. Oh, you missed work. You're going to get up on time. You get breakfast ready for the kids, and all this bad stuff's going to happen because you didn't have that signal going off. So that's the way pain is in our lives. It's this annoying alarm clock that's going off saying, hey, wake up. Things are wrong. You need to fix them. Right? And what's the first thing we do? We chase relief. And that's usually in the form of a lot of these passive modalities, and chiropractic is a passive modality. Passive meaning you are not actively involved. You're laying on the table. Someone else is doing the work. I'm a Christian, so I think about, we're supposed to be diligent and the taking care of our temple and our body. So yeah, not saying don't see a chiropractor, but it is our job to listen to the body and figure out what it's trying to say, and look for the true cause, right? If it's just your nervous system being stupid and causing misalignments for no reason, and maybe that's possible, that you can operate on that, and I refuse to entertain that in every case, as I think the body is intelligently designed. That's why I went that direction with talking about being Christian. So if you're not a believer, then you can think about this probably from more of an evolutionary, the body's just dumb and messed up and wrong. And yes, there's obviously a lot of problems and genetic deformities and congenital issues, right? And you might always have to see the chiropractor, right? But even in the chiropractic realm, I went to a lot of chiropractors where their goal was to maybe only see you once or twice a year, right? And they would just, usually these were the upper cervical docs, where they just adjust one bone every once in a while. You'd come in and get checked, but they wouldn't adjust, right? So that theory's out there that we should not be needing over and over and over and over again. Right? Sometimes you need to front load it. We need to make the changes early. But an ultimate goal is to find stability, is the fancy word. And I think of stability Whereas we have, like Samantha's case here, this imbalance. So to stabilize her, what can I do? I can adjust. I can stretch, trigger point this right side. I can do all the tricks I have. But how do I address weakness? Now, granted, it could be something more like a PNF, where I'm having her, actively resist and use the, even her head is off to the right. See, they've got that arrow there. Actively use these muscles to help pull her head back in line, right? And that's what we do in foundation training. It's kind of like doing a PNF. You're creating your own decompression system, essentially. We're opening up all the joints in the spine. We're lengthening it out and engaging so much muscle that we're trying to pull our bones back into alignment by creating just a lot of space, not just length, but width, right? And yeah, that's a lot to take in. And in foundation training, we don't even focus up here. I'm just talking about here because it's right in front of my face. But we could look at her hips too. We could say there's a lot of issue with the knees knocking, the external, we can see it on the left, the external rotation of the hip, the imbalance of the hip structure causing, issues up the chain into the neck. Looking here, right? The foundation is not underneath the structure where it should be. Move the ear forward to the hip, right? Even the hip and the lateral malleolus, which should be lined up, aren't lined up. So the foundation is off. So that's why they named it such. We have to retrain the foundation. We have to create a more stable base for the spine to sit on. Otherwise, all these misalignments are just going to keep appearing. So in Samantha's particular case, and let me read some things here. I want to show you the after as well. Of course, the smile is the biggest change. But ear, AC joint, hip, and this is only after 6 weeks. There's so much more we can do here. We have better alignment of the hips, better alignment of the shoulders. The knees are in a better position. This is from Lee Carroll. And one thing Samantha came for is, there was a lot of GI stuff. There was a lot of immune stuff going on with her. There was chronic fatigue. It wasn't just pain. And that what was an interesting case about her. It's like, can we help these things just like chiropractors would think, we could adjust the spine. It's going to help these things as well. And she was adjusted as well. We were adjusting her. She was doing 2 hours a week. And so that would include maybe 30 to 40 minutes of chiropractic, 30 to 40 minutes of, and it would change, of foundation training and then some chiropractic. Sometimes it'd be a longer session, more chiropractic and stretching, depending on what she needed. Some days she had so much fatigue that, we would just do a little decompression breathing. She wouldn't be able to do much more than get on the table and get work done, right? So we're not against that. Some days you need help, right? So Lee Carroll, his functional herbal therapy course, he talks about the NRF2 pathway. So moderate exercise as well as phytotherapy, and it's like herbs and stuff like that, can take the NRF2 pathways to help fight oxidative stress, right? Oxidative stress is what's always working against us too. It's like compression. NRF2 is the master regulator of cellular defenses. Dysregulation of NRF2 is linked to various diseases, including metabolic disorders, cancer, you name it, cardiovascular disease, making it a potential therapeutic target. So exercise, he would keep talking about this. His main point in it was working on phytotherapy and herbal therapy, but he kept saying, this works like exercise. This works like exercise. And I'm like, why don't we work more on exercise, and not just exercise, but retraining how we're moving. And that's the big difference. It's not just move more. That's not what I want you to walk away with as an idea. I want you to walk away with that there's a secret hack to moving more optimally. We don't have to get perfect about it. We don't have to get super nitpicky. We just have to keep working on climbing the peak, fixing little things one at a time. And what's great about that is you've changed how you're moving throughout your day, how you breathe, how you lift. It's all just slowly improving. And that way, the nervous system improves. Your spine stops going out of place all the time. You don't need to see the chiropractor all the time. Maybe you can keep going, but you're not in as much pain anymore, and you're more functional. And like I said, pain isn't a bad thing. A lot of people start training and they're more pain. They're like, what's going on? Well, there's been alarm clocks going off your whole life and you've just been ignoring them. And now you're starting to hear that. It's like, you ever been at like alarm going off? Like, shut that off. You're like, oh, I didn't even hear it, because you're numb to it, right? Your ringtone on your phone sometimes, right? You get so used to it and you're good at ignoring it. It's like the signals in your body. You learn to ignore. Somebody else is like, shut that dang thing off. You're like, oh, sorry, I didn't even hear it. It's like when I miss text messages all the time, right? You get the buzz. Don't even feel it. Wife's like, I tried to call you. Texted you. Why aren't you answering? Oh, I didn't even hear it. I didn't get that signal. Didn't go to my brain, right? We're so used to it. Not ignoring her on purpose, right? It's just brain was not alerted. Becomes not important. And when we create awareness, we're like, oh, it is important. It's probably important to pay attention for that alarm so I can address it. Like I need to address what my wife wants. I need to address what my body wants and what it's trying to tell me. So here's another one. Exercise, particularly regular exercise, activates the NRF2 pathway, which plays a crucial role in the body's ability to counteract the effects of oxidative stress and promotes overall cellular health. This activation occurs because acute exercise creates temporary controlled oxidative stress. You're stressing yourself. When we exercise, we do stress ourselves, and there's good stress. And I'll talk about that in the abstract here. Controlled oxidative stress, which then stimulates the NRF2 to increase the expression of antioxidant enzymes. Over time, this repeated stimulation leads to increased antioxidant defenses, enhancing the body's ability to protect against damage to cells. Wow. So exercise helps your immune system. And this is just more on like a neurological level too, a cellular level. But there's stuff happening on a broader, bigger mechanical level when it comes to your gut. Just really simple things. Like obviously your diaphragm and your hip flexors are connected. They can sandwich the gut. They, every time we breathe, they can help just move things through your 30-some foot of intestines, right? That's the big problem, just getting things out, right? That's a big issue with a lot of people because we get putrefaction and dysbiosis sometimes just because of how we move and how we don't move correctly. So let me read this little abstract. The NRF2 pathway and the endocannabinoid system. If you're familiar with that word, there's a lot of study with for the pain and CBD, we get from like the marijuana plant. But we also can stimulate that through movement, right? And again, Dr. Goodman has a whole book on a big part of it's focused on the endocannabinoid system as well. So the endocannabinoid system responds to stressors to influence cellular redox homeostasis. Placing stress on the body through moderate to high intensity aerobic exercises could potentially prevent or even fight chronic disease by activating our cellular defense systems. Yes, there is healthy stress, and it's called eustress. So the endocannabinoids reduce pain and anxiety, while the NRF2 pathway deals with antioxidant cellular defense. Both these systems can combat diseases involving neuroinflammation and oxidative stress. So this short study explores the effects of exercise, specifically foundation training and chiropractic, on diseases stemming from the nervous system and gastrointestinal tract. Dysbiosis and autoimmunity are complex topics that are not fully understood by the medical community at large. The purpose of this case study was to propose that not just a lack of exercise can contribute to gastrointestinal dysbiosis and in turn immunological diseases, but faulty movement patterns with their associated muscular imbalances and degenerative patterns may be just as important as a proper anti-inflammatory diet. The end goal is not only to help patients limit the number of medications they are taking, but also the number of expensive herbal supplements that have been growing in popularity. This is achieved by addressing the core problem of poor diet and faulty movement patterns. Then we go on to talk about Samantha, what we did. And it was really simple stuff, nothing really complicated. A lot of it just focused on, like we said, breathing and decompressing. And those are the two things, the one thing we do all day is breathe. Right? How many breaths do you take a day? And we have patterns based on restriction, the breath and the expansion of our rib cage and how we use our diaphragm and how we use our accessory breathing muscles is all based on patterns and restrictions. So the more we tap into using those breathing muscles or the diaphragm in a different way, the more we'll start to use that when we're not thinking about it, right? Because a lot of breathing is unconscious, right? It can't be conscious. It can be voluntary. But most of it's, especially when you're sleeping, right? It's involuntary. I can take a big breath, but when I'm sleeping, it's got to be different, right? And why do you wake up feeling like someone beat you with a baseball bat? Is it your bed? Is it because you have so much restriction in your body that your body doesn't know how to breathe correctly? Maybe there's just imbalances that are just pulling all night long. Straining when you're not conscious. We blame the bed, we blame the pillow. Do we blame how we're moving? Think about when you were a kid. You'd sleep in some really weird positions, right? You'd sleep on the floor. Right? You didn't wake up like we do now. We could say, oh, it's just age. And it is time. It is a time factor. We've given a problem time, right? And that can happen. There's young kids I'm seeing that have these patterns I see in 80-year-olds, right? Because they're dealing with so much more stress from technology than we did growing up, right? You're always outside playing, and now kids got their tablets and their phones, and they're just giving time to these poor faulty movement patterns. And the biggest problem with all the tablets and the phones and everything, all that technology, is that breathing puts us in poor breathing positions. The squat is one of the best breathing positions. It's really hard to breathe wrong in a squat. And you might say, well, I can't squat. It hurts my knees, it hurts my hips, my ankles. Right. And I'm not going to force you to squat right away. It's like I'm not going to go out and force you to flip a 550-pound tire. That's not where we start you. That's there for fun. We have fun things at the Fix. Just because I have tires and sledgehammers and kettlebells doesn't mean I'm never going to make you use them. A lot of what we do with foundation training, all foundation training is body weight. You go on their streaming site, and I encourage you to do so. It's all body weight stuff. A lot of it's just starting simple. They walk you through day one, working on breathing, working on hip hinging, just teaching the body to move as it was designed to move. So we can address these subluxations, these misalignments, and these nervous system stresses in the body to correct them. It's just a different way of correcting. And I would say it's even more chiropractic than chiropractic. It's literally, because we always talk about the ADIO, above, down, inside, out. We are addressing from inside out. No one can really adjust you from the inside out but yourself, right? And the breath and the power of expansion. You don't think the breath and that pressure system has any power? People throw their back out, sneezing or coughing. Your diaphragm, your pelvic floor, your thoracic inlet, which are all like the three diaphragms in our body that control pressure systems are extremely powerful. Used in the wrong way, they can cause a lot of issues. Used in the right way, they can fix a lot of issues. So I know this is a long rant, but hopefully this gets to some of the bottom of it. And go ahead and leave me some questions. If you want a copy of this, I will maybe just quickly run through it here. I'm not going to read it, but you can just pause and read. There's the abstract. Here's the introduction. Pause and read. Here's that picture again, Samantha. Still a smile. Get her feet there. That's important. Feet are very important. And there's some of those numbers just describing a little bit of what I described, but there's a lot more depth there. This is what we did in the assessment. We did week per week. A little bit more of what we did. And here's the conclusion. There's a couple of those references on the NRF2. Yeah, there's Samantha's smiling face again. And there's me. And I hope this was helpful. Hope this gave you an idea of what foundation training can do for you. You're still wondering what the heck it is. And there's a video of us doing a little bit together. That's what this link is, which should take you to. And we'll go ahead and put this video underneath that link as well.